Imagine spending twice as much for the same product as someone in another country. Sounds unfair, right? This is exactly what's happening with healthcare costs in America. Now let's talk numbers. It's a well-known fact that the United States spends a lot on healthcare. Around 18% of its gross domestic product, to be precise. That's nearly 1/5 of the entire economy. It's a staggering amount, especially when compared to other developed nations. Take our neighbors to the north, for instance. Canada spends approximately 11% of its GDP on healthcare. That's a 7% difference, which might not seem like much until you consider that it translates to billions and billions of dollars annually. And it's not just Canada. In Germany, they spend roughly 11.5% of their GDP on healthcare. In the United Kingdom, it's about 10%. Even in Switzerland, a country known for its high cost of living, the healthcare expenditure is around 12% of GDP. So what gives? Why is it that in America, we're spending so much more? The answer isn't simple, but a part of it has to do with the fact that healthcare in America is largely privatized, leading to high costs for everything from prescription drugs to hospital stays. But it's not just about the money. It's about the impact this has on everyday Americans. High healthcare costs can lead to stress, delayed or avoided medical care, and even bankruptcy. It's a heavy burden to bear, and it's one that people in many other countries simply don't have to worry about. These comparisons aren't meant to paint a gloomy picture, but rather to illuminate a stark reality. We're spending more, but are we getting more? That's a question worth pondering. So, why do Americans pay so much for healthcare? And is there a better way? The answer might lie beyond our borders. For many Americans, healthcare isn't just expensive. It's a maze of insurance coverage, out-of-pocket costs, and access to quality care. The American healthcare system is a complex web that often leaves its users confused and burdened. High insurance premiums are one of the major stumbling blocks for many. The monthly amount that people pay for health insurance can be exorbitant, and that's just the tip of the iceberg. But it doesn't stop there. Even with insurance coverage, the out-of-pocket expenses can be astronomical. Think about it. You're paying a hefty sum each month for health insurance, yet when it comes time to use that insurance, you're still facing significant costs. Prescription medications, co-pays for doctor's visits, deductibles. These costs can pile up quickly, often leading to a financial strain. Now, let's talk about the elephant in the room: access to quality care. Despite spending more on healthcare per person than any other country, the United States often falls short in terms of healthcare outcomes. Many Americans, particularly those in rural areas or low-income communities, struggle to access the high-quality care they need. The distances to hospitals or lack of specialists in their area can mean long waits and travel times, resulting in delayed or even missed treatment. These issues aren't just numbers and statistics. They're the lived experiences of countless individuals. Picture a single mother working 2 jobs, struggling to afford her child's asthma medication, or a senior citizen in a rural community having to travel miles for a simple checkup. These are the faces of the American healthcare challenges. These challenges are real and affect millions of Americans. But how do other countries handle these issues? Let's take a trip around the world and see how other countries are tackling healthcare. Imagine a place where healthcare is considered a right, not a privilege. That's the ethos driving Canada's healthcare system. It operates on a publicly funded, single-payer model, meaning the government pays for healthcare through taxes. Every Canadian citizen has access to medical services regardless of their income level. While this system ensures everyone gets the care they need, it's not without its challenges. Long wait times for non-emergency procedures are common, and some advanced treatments may not be covered. Now let's hop over the Atlantic and take a look at Germany. Here, the healthcare system is a mix of public and private, ensuring a high standard of care for everyone. Germans are mandated by law to have health insurance, and the cost is shared between the employer and the employee. The result? Almost total coverage, with around 99% of the population insured. However, the system can be complex, and navigating it can be a challenge for some. Let's not forget about Singapore, an island city-state known for its efficient and innovative approach to healthcare. The system here is a unique blend of public, private, and personal responsibility. It's centered around the principle of saving for future healthcare needs. Every working Singaporean contributes a portion of their wages to a personal health savings account, which can be used for hospital bills and certain outpatient treatments. As we travel through these different healthcare landscapes, it's clear that there's no one-size-fits-all approach. Each system has its strengths and weaknesses, and each reflects the cultural, economic, and political realities of its country. Different countries, different models. But what does this mean for their citizens? Healthcare is more than a system, it's about people. Let's see how these different models impact people's lives. When we look at how healthcare models in other countries affect their citizens, we see some striking contrasts. For instance, take Canada, a country that has adopted universal healthcare. Here, every citizen has the right to access healthcare services without fear of financial ruin. This is a stark contrast to the American system, where many individuals are burdened with substantial healthcare costs. Now, let's turn our attention to Germany, a country with a mixed public-private healthcare system. In Germany, healthcare is considered a social right, and the government ensures that both public and private sectors contribute to the overall health of the nation. This model creates a balance, allowing the citizens to enjoy high-quality healthcare services at affordable costs. Again, this is a far cry from the American system, where the high costs often deter people from seeking necessary medical care. In the United Kingdom, healthcare is largely funded by the government through tax payments. The National Health Service, or NHS, provides most health services free of cost at the point of use. This model ensures that healthcare is not a privilege but a right, making it accessible to all, regardless of their economic status. This is a significant difference from the American model, where healthcare access is often tied to one's ability to pay. In Japan, everyone must have health insurance, either through their employer or the national program. The costs are much lower than in the United States, and no one is denied healthcare due to inability to pay. This model ensures that every citizen has access to healthcare, again, presenting a contrast to the American system, where many people lack health insurance. Clearly, there are different ways to approach healthcare. What can we learn from these models? The common thread among these systems is the commitment to ensure healthcare access for all, regardless of income or employment status. It's a lesson we can all take to heart as we consider the future of healthcare in America. In a globalized world, learning from others is not just smart, it's necessary. And so, we arrive at the crux of our discussion today, learning from the world about healthcare access. We've explored the cost and challenges of the American healthcare system, taken a glimpse at healthcare access abroad, and highlighted the key differences that matter. Healthcare, like many other aspects of society, doesn't exist in a vacuum. It is a global issue intertwined with economics, politics, and social structures. The way healthcare is approached, funded, and delivered varies significantly from one country to another, each with its unique strengths and weaknesses. Take Canada, for instance, where a universal healthcare system ensures every citizen has access to medical services. Or Germany, where a mixed public-private system provides a high standard of care while keeping costs down. These systems are not without their challenges, but they offer valuable lessons for the United States. Affordability and accessibility are two major aspects of healthcare that America can learn from. In the US, healthcare costs are a leading cause of personal bankruptcy, a reality that's virtually unheard of in countries with universal healthcare. And while the quality of care in the US is among the highest globally, access to that care is far from universal, often tied to employment or financial status. In contrast, countries like the United Kingdom, Australia, and many others have created systems where access to healthcare is seen as a right, not a privilege. These models, while not perfect, highlight the potential for a more equitable healthcare system. In considering these lessons, it's important to remember that there's no one-size-fits-all solution. Each country's healthcare system is shaped by its unique historical, political, and cultural context. However, recognizing these differences and learning from them is a crucial step towards creating a system that better serves all Americans. It's time we look beyond our borders and consider what we can learn about healthcare. Because in the end, it's about creating a system that works for everyone.